Atrophy, it's a word that might sound complex, but it describes a process we're all familiar with, shrinking. In the context of our bodies, atrophy refers to the decrease in size of cells, tissues, or organs. It's like a balloon, slowly deflating, losing its fullness and functionality. This shrinkage isn't just about aesthetics, it signifies a decline in the affected area's ability to perform its job. Imagine a muscle that once powered you through marathons, now struggling to lift groceries, or a brain once sharp and alert, now battling forgetfulness. That's atrophy at work, and it can affect various parts of the body, from muscles and bones to organs like the brain and heart. There are two primary types of atrophy, physiological and pathological. Physiological atrophy is a natural part of life, often associated with aging. As we grow older, our bodies naturally undergo changes, and some degree of cell and tissue shrinkage is expected. Think of it like the gradual wear and tear on a well-loved car. Pathological atrophy, on the other hand, stems from disease, injury, or other external factors. It's like an unexpected breakdown, a deviation from the normal course of things. Conditions like malnutrition, nerve damage, and hormonal imbalances can all trigger this type of atrophy. Understanding the difference between these two types is crucial for addressing the root cause of atrophy and exploring potential treatments or preventive measures. Atrophy, the gradual shrinking of our body's cells, tissues, or organs, is often a symptom of an underlying issue. Let's delve into some common culprits behind this decline. 1. Disuse atrophy. Imagine a cast encasing your arm after a fracture. While it helps the bone heal, the lack of use causes your arm muscles to weaken and shrink. That's disuse atrophy in action. It occurs when muscles or other tissues aren't used regularly, leading to a decrease in cell size and function. Astronauts, for example, experience muscle and bone atrophy due to the low-gravity environment of space. 2. Neurogenic atrophy. Our nervous system acts as the command center for our muscles. When nerves are damaged through injury or diseases like polio, the signals to muscles get disrupted, causing them to waste away. This is known as neurogenic atrophy. 3. Malnutrition. Our bodies require a steady supply of nutrients to function optimally. When we don't consume enough calories, proteins, vitamins, and minerals, our bodies go into survival mode, breaking down muscle tissue for energy. This can lead to muscle wasting and weakness, a hallmark of malnutrition-induced atrophy. 4. Ischemia. Imagine a kink in a garden hose restricting water flow to your plants. Similarly, ischemia occurs when blood flow, carrying vital oxygen and nutrients, is reduced to a specific area. This deprivation can starve cells, leading to atrophy. A common example is heart muscle atrophy following a heart attack where blood supply is compromised. 5. Hormonal imbalances. Our endocrine system, responsible for producing hormones, plays a critical role in regulating various bodily functions, including growth and development. Imbalances in hormones like insulin, thyroid hormone, or sex hormones can disrupt these processes and contribute to atrophy. For instance, people with low thyroid hormone levels, hypothyroidism, may experience muscle weakness and atrophy. 6. Aging. As we age, our bodies naturally undergo a gradual decline, including a decrease in cell activity and regeneration. This can lead to age-related atrophy, particularly affecting muscle mass and bone density. While we can't stop the aging process, we can adopt healthy habits to slow down its effects. 7. Autoimmune diseases. In a case of mistaken identity, autoimmune diseases cause the body's immune system to attack its own healthy cells and tissues. This can lead to inflammation and damage, contributing to atrophy in the affected areas. Rheumatoid arthritis, for example, is an autoimmune disease that causes joint inflammation and can lead to muscle atrophy. Understanding the various causes of atrophy is crucial for effective prevention, diagnosis, and treatment. By addressing the root cause, we can potentially slow down, halt, or even reverse the shrinking process and preserve the functionality of our bodies. Atrophy, the shrinking of our body's cells, tissues, or organs, can manifest in various ways, depending on the affected area and the underlying cause. Recognizing these symptoms is crucial for seeking timely medical attention and addressing the root cause. 1. Muscle atrophy. One of the most noticeable signs is muscle wasting, where muscles appear visibly smaller and weaker. This can lead to decreased strength, difficulty performing everyday tasks, and increased risk of falls, especially in older adults. Imagine struggling to lift a bag of groceries that was once effortless or feeling unsteady on your feet. 2. Cognitive decline. When atrophy affects the brain, it can lead to cognitive impairment, affecting memory, thinking, and reasoning abilities. This can manifest as forgetfulness, difficulty concentrating, or struggling to find words. Imagine forgetting familiar names, misplacing objects frequently, or having trouble following conversations. 3. Organ function deterioration. Atrophy can also impact the function of vital organs. For instance, atrophy of the heart muscle can weaken its ability to pump blood effectively, leading to fatigue, shortness of breath, and other symptoms of heart failure. Similarly, atrophy of the kidneys can impair their ability to filter waste products from the blood, potentially leading to kidney disease. 4. Skin changes. Skin atrophy, often associated with aging or certain medical conditions, can cause the skin to become thinner, more fragile, and prone to bruising. Imagine noticing wrinkles, sagging skin, or easily torn skin, even from minor bumps or scrapes. 5. Hair loss. In some cases, atrophy can affect hair follicles, leading to hair loss or thinning. This can occur on the scalp, face, or other parts of the body. Imagine noticing more hair than usual on your brush or pillow, or experiencing receding hairlines or bald patches. It's important to remember that these symptoms can be indicative of various conditions, and self-diagnosis is never recommended. If you experience any of these symptoms, it's crucial to consult a healthcare professional for proper evaluation, diagnosis, and treatment. Section 5. Diagnosing atrophy. Uncovering the silent decline. Diagnosing atrophy, the gradual decline in cell and tissue size, often involves a multifaceted approach to pinpoint the underlying cause and assess the extent of the condition. First, the journey often begins with a thorough physical exam, where the doctor observes the affected area for visible signs of atrophy, such as muscle wasting or skin thinning. They may also assess muscle strength, reflexes, and range of motion to gauge functional impairments. Next, to peer beneath the surface, imaging tests like X-rays, ultrasounds, kinetic scans, or MRI scans can provide detailed images of the affected area. These scans can reveal changes in muscle mass, bone density, or organ size, helping to confirm or rule out atrophy. For suspected nerve-related atrophy, an EMG can measure the electrical activity of muscles and nerves. This test involves inserting small needles into muscles to record their electrical signals, helping to identify nerve damage or dysfunction. Analyzing blood samples can provide valuable insights into the overall health status and potential underlying causes of atrophy. Tests may include checking for nutritional deficiencies, hormonal imbalances, inflammatory markers, or signs of autoimmune diseases. In some cases, a biopsy involving the removal of a small tissue sample for microscopic examination may be necessary. This can help to identify specific cellular changes associated with atrophy and rule out other conditions. Section 6. Combating atrophy treatment and management strategies. 1. Physical therapy and exercise. For atrophy caused by disuse or inactivity, physical therapy plays a crucial role in restoring muscle strength, flexibility, and range of motion. Imagine a personalized exercise program designed to target weakened muscles, gradually increasing in intensity and challenge. 2. Dietary changes. Addressing nutritional deficiencies is vital in cases of malnutrition-induced atrophy. This involves incorporating a balanced diet rich in protein, calories, vitamins, and minerals to provide the body with the building blocks it needs for cell growth and repair. Imagine a plate filled with colorful fruits, vegetables, lean proteins, and whole grains, fueling your body's recovery. 3. Medications. In cases where atrophy stems from underlying medical conditions, managing those conditions through medication is crucial. For example, hormone replacement therapy may be prescribed for hormonal imbalances, or corticosteroids may be used to reduce inflammation in autoimmune diseases. 4. Surgery. In some cases, surgery may be necessary to address the underlying cause of atrophy. For example, if a compressed nerve is causing muscle atrophy, surgery to relieve the pressure may be recommended. Or in cases of severe joint damage from arthritis, joint replacement surgery may be an option. 5. Assistive devices. For individuals experiencing functional limitations due to atrophy, assistive devices can help improve mobility and independence. Imagine using a cane or walker for support, a reacher grabber to retrieve objects, or adaptive utensils for easier eating. Treating atrophy is not a one-size-fits-all approach, but rather a personalized journey tailored to each individual's needs and circumstances. Section 7. Preventing atrophy: proactive steps for a healthier future. While we can't entirely halt the natural aging process or eliminate the risk of all diseases, we can take proactive steps to reduce the risk of atrophy and maintain a healthier, more vibrant life. 1. Regular physical activity. Just like a car parked in the garage for too long, Our bodies need regular movement to stay in top shape. Engaging in regular physical activity, including both cardiovascular exercise and strength training, helps maintain muscle mass, bone density, and overall health. Imagine brisk walks in the park, invigorating bike rides, or strength training sessions at the gym, keeping your body active and resilient. 2. Balanced diet. Nourishing our bodies with a balanced diet rich in fruits, vegetables, lean proteins, and whole grains provides the essential nutrients needed for cell growth, repair, and overall well-being. Imagine your plate as a canvas for colorful, nutrient-packed foods fueling your body from the inside out. 3. Early diagnosis and management of underlying conditions. Many medical conditions can contribute to atrophy, so early detection and management are crucial. Regular checkups, screenings, and seeking medical attention for any concerning symptoms can help identify and address potential issues before they escalate. 4. Maintaining a healthy weight. Being overweight or obese can put extra stress on joints and muscles, increasing the risk of atrophy. Conversely, being underweight can also lead to muscle loss and weakness. Maintaining a healthy weight through a balanced diet and regular exercise is essential for overall health and atrophy prevention. 5. Avoiding prolonged immobilization. While rest is crucial for healing after injuries or surgeries, prolonged immobilization can lead to muscle atrophy and weakness. Working with physical therapists and following recommended rehabilitation programs can help minimize muscle loss and regain function faster. Preventing atrophy is an ongoing journey, not a destination. Section 8, a case study in muscle atrophy. John's story. John, a retired engineer in his late 60s, always enjoyed an active lifestyle, hiking, gardening, and playing tennis regularly. However, after a fall that resulted in a broken leg, John's mobility became severely restricted. Confined to bed rest for several weeks, followed by months of limited movement, John noticed a significant change in his once strong leg. The muscles had visibly shrunk, and even simple tasks like climbing stairs or carrying groceries became challenging. Concerned about his declining strength and mobility, John consulted his doctor. A physical examination confirmed muscle atrophy in his injured leg, and John was referred to a physical therapist. The therapist designed a personalized exercise program for John, starting with gentle range of motion exercises and gradually progressing to strength training activities. John was also advised to focus on consuming a protein-rich diet to support muscle recovery. Through consistent effort and dedication, John gradually regained strength and function in his leg. The atrophy slowly reversed as his muscles responded to the exercise and nutrition regimen. John's story highlights the importance of addressing atrophy promptly and the remarkable capacity of the human body to recover and rebuild with the right support and intervention.